On November 28th, 2021, I was scrolling through Twitter, and I came across this tweet by @SailingKateMD. Check my ICU list after being gone for a few days for the holiday. Every single one of my COVID patients died while I was gone. All of them. Reading that tweet that evening, it hit me like a truck. I was 6 years out of medical school and 3 years into my career as a physician for hospital inpatients. The pandemic was not new anymore, but while the world was trying to move on from it, we were still struggling with waves of COVID-19 patients. We had some new treatments, and vaccines were on the horizon, so we didn't feel quite as helpless, but in the previous year, I had seen more death than in my entire life prior. As I read that tweet, I could hear the voices of my patients saying goodbye to their loved ones who weren't allowed to visit, so it was via phone or iPad. I could feel the indentations and the markings on my face from the N95 mask. I could see the patients dying in their beds, and I could see the social media posts pretending it wasn't happening. As I walked into the kitchen, that tweet still glowing on my phone, my brain screamed. It was like all the helpless thoughts and feelings were spilling out, and my mental lid couldn't hold them in any longer. I could feel the rattling of my brain's cage. So I turned to my favorite mindless activity. I put in some headphones, threw on a podcast, and started doing the dishes. The soapy water was supposed to wash away my bad thoughts, but instead I just felt like I was drowning. I quietly put down the sponge, took out my headphones. My knees felt wobbly. I walked into the living room where my wife sat on the couch, and as I sat down, that tweet still painfully in my head, I could hear myself say, I don't think I'm okay. I don't think I'm going to be okay for a long time. In a weird out-of-body experience kind of way, as I think back on that moment, I can see my wife's jaw drop as I collapsed in tears. She scrambled across the couch to take my sobbing, shuddering body in her arms, and as we huddled together, I felt it all. Every dying patient, every piece of disinformation I came across, every argument I had to make in favor of masks and other mitigation measures, it all came flooding out of me. I hadn't cried that hard in over a decade. Eventually, my tears subsided and we exhaustedly went to bed, but I still wasn't okay. I knew I had to find a way to confront the disinformation, not just to help the public, but to help myself. A 2023 study by Camellia Adams looked at physicians who worked in the first wave of the pandemic. Among other things, they noted that despite efforts to employ adaptive coping, physicians' rates of psychological and physical health difficulties remained high or worsened over 1 year. The Adams study reminds me that I'm not alone. Other doctors' mental health suffered too. In 2020, as the virus was ramping up, I and other physicians assigned to COVID-19 centers, we quickly became experts in the diagnosis and treatment of the disease, while also acknowledging that we had limited and rapidly changing information. Beyond the hospital, I started posting more on social media in order to educate my little corner of the internet. Because, as I would tell people later, it was either that or find another couch to cry on. So I started with Facebook, and then a blog, and then Instagram slides, but I wasn't making the impact that I wanted because the algorithm had already moved on from still pictures. That wasn't where the kids were getting their information, so I made a TikTok account and officially became Doc with Bowtie. As the pandemic of disinformation raged on, my aversion to brevity relented, and I just put myself in front of the camera to talk directly to the people. I approached the camera the same way I do patients in real life. Because as you can tell, by the way I stand up here, I like the sound of my own voice. Hi, I'm Dr. Joseph Thomas. I'm from internal medicine, and I'm here to help take care of you today. And then I pull up a chair, and I sit down. Because a study published in the Journal of Hospital Medicine, led by Dr. Blair Golden, showed that that can help enhance doctor-patient communication, which kind of seems obvious. But as physicians and scientists, we love data to back up what we do. So I sit down and I put myself at the patient's eye level, and I explain their diagnosis and treatment in a way that they can understand. And I invite them to be a part of their treatment plan as an important member of their healthcare team. Sometimes doctor-patient encounters are just as simple as that. Others, however, I find myself face-to-face with someone who has been misled by misinformation. And a dismissive or mocking response never works in these situations because ultimately this is a person who is trying to take charge of their health somehow. So I try to establish a rapport, not just by sitting, but by actively listening and letting the patient know and emphasizing that our goal is the same, that patient's good health. On my social media and in my videos, the goal is still the same, but for public health. Sharing good information, debunking misinformation from a trustworthy and relatable source. Ideally, we would simply be able to point out the facts and evidence or lack thereof, and that would be enough to accomplish this task. But it isn't. A culture has developed around the rejection of science, and people take refuge in that to the point where it shapes their communities. Even if I make headway with a patient, they may go back to that community, and it's easy to fall back into the conspiracy theories and the anti-science thinking. Even if somebody in the community realizes and identifies the incorrect premise, they may be rejected by those around them simply for pointing it out. In his book, How Minds Change, author David McRaney examines the science of beliefs and persuasion, and he writes, "Social death is more frightening than physical death. We would rather be accepted by our social groups than be right." So we chip away at the misinformation by pointing out the facts and the evidence, but also the legitimacy of sources. In 2020, I started making more effort because I saw disinformation-spreading doctors rise and try to influence people away from evidence-based medicine. They love to make all sorts of claims like they look for root causes without any real evidence, and they like to claim that they are being silenced. It's hard to see through these claims because there are usually kernels of truth amid the unsupported statements, and it's all wrapped up in catchy messaging. But they love to announce that they're being silenced from their social media accounts with millions of followers, or from podiums at press conferences, or from prominent meetings with political leaders. They may tell you to follow the money while they simultaneously charge you for unregulated supplements or treatments outside of medical insurance. These treatments usually don't have any real evidence behind them, and they probably won't get rid of your disease, although they will help you get rid of money from your wallet. They use all or nothing logic and oversimplification to sell their claims, and it's hard to push back on that. Brandolini's law states that the amount of energy needed to refute disinformation is an order of magnitude bigger than that needed to produce it. So how do we fight back? We must be more transparent and show others the gray area. The prevailing stereotype is that doctors are unfeeling and aloof, simply seeing our patients and going home at the end of the day without any strong feelings. But science is never black or white, it's never all or nothing, and neither is humanity. So we can bridge that gap. It's as simple sometimes as me taking a moment out of my explanation to acknowledge this sucks, and I hate this for you. That bridge, it's a bridge between myself and the patient, it's a bridge of humanity. It can mean a bridge over a gap in the patient's knowledge, or a gap in my own, or a gap for both of us. But they are more likely to meet me on that bridge as we approach their healthcare together. There are gaps in science and in medical knowledge. Pseudoscience loves to fill those gaps in with making things up. Usually they don't have any evidence. But we can build that bridge over those gaps and make a difference. Similarly, on social media, I try to bring that moment of humanity there as well. When a fellow healthcare worker tried to dismiss COVID-19 based on its 99% survival rate, I put that in a human context. 99% survival means 1% death. And in the United States, that means 3.3 million people. 3.3 million families whose lives would have been shattered by the loss of a loved one. And that statistic is also too simple because it's not just all or nothing. It's not just survival or death. Many people who are infected with COVID-19 or other preventable illnesses will survive, but they'll come away with long-term consequences, sometimes severe ones. But those people get lost in the oversimplification of these numbers. I can't always give oversimplified talking points because science doesn't work that way. I still have to make my points quickly, but I try to provide that pause, that moment of humanity, by providing facts and evidence, but also some context. In the book Hope for Cynics, Jamil Zaki talks about the concepts of cynicism in the modern sense versus hopeful skepticism. Cynicism is a negative view which may seem clever at first, but which quickly shuts down new information and hides behind negative attitudes towards people. Hopeful skepticism, on the other hand, is a worldview in which we examine things critically, but we are open to new data if there's good evidence behind it. That's why Dr. Golden looked at the science and the data behind sitting down while talking to a patient. Medicine is full of these moments of hopeful skepticism that provide data to support our practices. But it's never that easy to change minds, is it? So how do we dispel these myths? My colleagues have written about borrowing techniques from other specialties and other fields to help us in our fight against disinformation. From the world of librarians, there's SIFT, stop, investigate the source, find trusted coverage, and trace it back to its original context. From the world of climate science, there's the three-step method. State the fact, identify the related myth, and explain the fallacy, why that myth is false. We can use these techniques to aid our efforts. The COVID-19 pandemic may have settled into an endemic phase, but the pandemic of disinformation, or infodemic, as identified by Dr. David Scales and colleagues, still rages on, and both are far from over. The COVID pandemic requires continued funding to refine vaccines and other treatments. The infodemic, on the other hand, requires the efforts of people like you, everyone watching this talk. If we can identify pseudoscience where it rears its ugly head, we can put a stop to it and its spread. So as we examine our own beliefs and we make these efforts and use these techniques, we can keep these things in mind. Number one, meet people where they are. Whether you like longer, nuanced explanations and blog entries or shorter, succinct TikToks that may introduce new reading, it's important to look at a variety of sources and share based on who your intended audience is. Number two, pseudoscience loves oversimplification and making things up where science hasn't quite figured it out yet. Number three, follow the money. The Sunshine Act allows you to look up any licensed physician and see how much money they take from Big Pharma. Is it a few lunches a year, like when you look me up? Or is it a substantially greater amount? You can also see if they are selling unregulated supplements and pushing you away from evidence-based physician treatments, creating a pretty big conflict of interest. And finally, number four, a moment of humanity provides needed context. It can be easy to hide behind catchy social media posts and memeable disinformation, so look for the people who aren't profiting, who are looking to simply share the information and acknowledging the gaps in the system and in the science without making things up to fill those in. In the fall of 2022, I was asked point blank if I thought that my efforts were making a difference, or if I was just making content for content's sake. My best friend asked me if I'd ever changed anyone's mind. I said I wasn't sure, and I reverted back to that previous statement. It was either try to educate people or cry in a corner. And that probably would have been the end of it, except similar to the time of my big cry, my wife was there. She immediately piped up, "Didn't you just show me a message yesterday of that pregnant woman that got vaccinated because of your posts?" My wife is funny because she doesn't always stand up for herself. But if somebody she loves doesn't get the recognition they deserve, she goes full mama bear in ferocity. And as usual, she was right. I had been writing about mRNA vaccines and pregnancy and trying to dispel the myths about infertility that had been spreading. The sister of a friend of mine from high school had messaged to tell me that my post had convinced her to get vaccinated, but she had a question about which vaccine to get. My wife went on to talk about other comments she'd seen, other posts that I'd shared with her, about people who had read my posts and they had been convinced to get vaccinated, or at least to think twice before avoiding them. I forget that sometimes I focus too much on the big dramatic posts or the comments that belittle me for advocating for public health. Those aren't the people I'm necessarily going to reach. It's the people who are in between the extremes, who are reading those comments and reading my posts, who are just trying to do right by their health, by their loved ones, who aren't profiting from any of the misinformation. Those are the people whose minds I can change. In my videos, I mention how vaccines require widespread uptake in order to create a blanket of protection against disease. I make videos and try to put facts in front of people as a vaccination against the infodemic. I hope that I have inspired you and empowered you to do the same. Thank you.